Examination of thyroid swelling. The thyroid gland is located in front of the neck with its two lobes on either sides of the trachea connected by an isthmus. We begin our examination of the thyroid swellings by inspection. For inspection, make the patient sit on a stool with the neck slightly hyperextended and inspect the thyroid from the front. Asking the patient to swallow makes the thyroid more prominent for inspection. If the patient has a short and fat neck, ask the patient to clasp the hands over the occiput and push the head backwards against the resistance of the clasped hands. This is the Pizzillo's method to make the thyroid more prominent for inspection. First, note the size and shape of the swelling and its situation, whether it is on one side of the midline, in the midline, or whether it extends on both the sides. Measure the exact size in centimeters using a measuring tape. Now note the extent of the swelling, particularly the lateral border in relation to the sternomastoid and the lower border in relation to the suprasternal notch of the sternum. A thyroid swelling always lies deep to the sternomastoid muscles, as demonstrated here by contracting the sternomastoids. Then note whether the lower border ends above the suprasternal notch or it extends behind the suprasternal notch. Both the borders will be better appreciated if the patient is asked to make swallowing movements during the inspection. Next, inspect the surface of the swelling. A simple goiter and single nodules have a smooth surface, while a multinodular goiter has a nodular or bossellated surface. Note the bossellated surface of this large multinodular goiter in a young male patient. Then inspect the skin over the swelling and look for redness and edema suggestive of inflammation, scars of previous surgery, sinuses, and dilated veins. Note this transverse scar of previous thyroid surgery, which tells us that this is a recurrent thyroid swelling. And this is a sinus in the midline of the neck discharging mucus-like fluid. This is a thyroglossal fistula. Then watch the swelling for a few seconds quietly for pulsatility. Now ask the patient to swallow and look for an upward movement of the swelling. A thyroid swelling characteristically